Hello, my name is Dr. Fahim Khan. I'm a consultant rheumatologist at the UPMC or T1 Hospital Kilkenny, and I want to talk to you about myofascial pain syndrome, which is mostly affecting upper back muscles, and we see it very common in patients who suffer from chronic pain. But this myofascial pain syndrome is associated with many other conditions and risk factors predisposing to this condition. So we see myofascial pain syndrome on its own, which affects pain and stiffness, associated with headaches and ongoing discomfort with stiffness. And sometimes patients would have generalized aches and pains. We use the term fibromyalgia, and they would also have myofascial pain syndrome associated with it. So in other words, myofascial pain syndrome can occur on its own or in combination with fibromyalgia. So how do we treat myofascial pain syndrome and what are the causes for it? The most important thing to understand is myofascial pain syndrome particularly affects your neck and upper back muscles. More importantly, the trapezius cervical muscle groups, and patients tend to develop these tight bands of tissues which are called tender points. And these tender points are basically defined as active tender point or trigger point, which typically lies within a muscle, and applied pressure results in pain at the site of the trigger point or along the same muscle. But there are also some latent trigger points as well, which are rather inactive or dormant but could become active. And a secondary trigger point is not in a muscle other than the one with an active trigger point. An active trigger point or a secondary trigger point can become irritated at some time. So these tight bands of tissues normally causes this pain, which is classified as myofascial pain syndrome. Symptoms of myofascial pain syndrome is pain that could be aching, throbbing, tight stiffness, tight bands of tissue with active tender points, sore muscles, weak muscles, reduced range of motion, associated with headache, poor sleep, anxiety, stress, fatigue, and so on. So what causes this myofascial pain syndrome? Most importantly, it's repetitive motions like repetitive stress affecting the upper back muscles lead to these trigger points. Muscle injury, poor posture, they all contribute to the formation of myofascial trigger points and myofascial pain syndrome. So poor posture leads to active trigger points. Too much repetitive strain, whether it's working with computer or long distance driving, constant strain on your neck and upper back muscle with a poor posture leads to this myofascial pain syndrome. Risk factors that might contribute to development of myofascial pain syndrome include muscle weakness, lack of muscle activity, working in or living in a cold environment, emotional stress. And there are some metabolic conditions as well which we normally look at, for example, thyroid disease, diabetic neuropathy, etc., vitamin deficiency, vitamin D, folic acid, etc. How do we diagnose myofascial pain? So diagnosis of myofascial pain syndrome is mostly clinical. History is taken, looking for predisposing conditions, what contributes to it, and alleviating and removing any stressors that lead to myofascial pain syndrome. So in rheumatology practice, the most important thing would be pain relief. The pain relief is achieved by injecting into the trigger points, into the anatomical site of trigger points. We use a local anesthetic or a cortisone or a steroid injection, which gives good relief. But patient may need a course of injections over a period of a few weeks, and that relieves the pain quite well. Posture correction exercise, upper back stretching exercise remain to be the mainstay of treatment for the myofascial pain syndrome. Physiotherapy is also of great help. Dry needling also helps. Spray and stretch using the trigger point. For example, spraying a trigger point with a coolant, then slowly manually stretching muscles. Heat therapy also helps, like moisture therapy is also effective. Ultrasound therapy, TENS therapy, acupuncture, cognitive behavior therapy, they all contribute to easing of the tension in the muscle. So if you have to use medications or pills or pharmaceutical medications, pain relief, simple painkillers, we try them. Sometimes we have to use non-steroidal anti-inflammatory medications, muscle relaxants. In some patients, if there's a element of depression, stress, perhaps antidepressant medication or medication like amitriptyline, which is used for pain relief, also helps myofascial. Sometimes muscle relaxants are of great help as well. They help. So what can you do at home? Then you can also try a few things at home to relieve your symptoms. Ice packs would reduce inflammation. Heat packs is mostly to relax your muscles, and I prefer predominantly using moist heat, wet heat than dry heat. Myofascial pain syndrome exercises, which is stretching the muscle, strengthening the muscle, and so on. So there's exercises which I have them on my website as well. Or the counter pain relief, for example, acetaminophen. If there's no contraindication, ibuprofen can also be taken. Relaxation techniques like yoga, Pilates, stretching exercise, breathing exercise, meditation, and massage therapy. Massage therapy is only when the acute pain is gone, but I prefer a physical therapist who could do perhaps myofascial release or deep massage might also help, but not in acute painful situations. Rheumatologists are able to set up a program of treatment for the patients, including trigger point injections. So my advice would be to get in touch with your local doctor, primary care physician, and refer to a rheumatologist who deals with this condition. However, some patients are also referred to pain specialists regarding treatment for myofascial pain syndrome. So if you guys have any questions, concern, please get in touch with me on my website, www.arthritisandpainclinic.com, www.arthritisandpainclinic.com. Thank you so much. My name is Dr. Fahim Khan. I am a consultant rheumatologist at the UPMC Ortevan Hospital, Kilkenny, where I see patients with fibromyalgia, myofascial pain syndrome, with the above mentioned measures are applied to the patient, and most of the patients, they do very well once they go through the proper mode of treatment, including physiotherapy and exercise program. Thank you so much. Bye bye.